CDC has they initially sent out a number of tests to all of the state labs, and that was a couple of weeks ago now at the beginning of February, and then they had to retract all of these testing kits that were disseminated to these state laboratories as a part of the U.S. response to be able to monitor this new epidemic that's really becoming a pandemic pretty quickly, and so lately the testing has been inadequate, I think, for the country, and there's been sort of some blunders along the way in terms of the design of the test and what the CDC has distributed. But the frustrating thing, I think, for people who are trying to perform tests for their patients is that we just don't have the capacity in the United States and the local laboratories that would normally be testing for different respiratory viruses have been banned from being able to do that because of the declaration of a public health emergency by the CDC.
To what extent, though, Dr. Mina, are any country's ability to test much better than the US is? Does everyone lack capacity, and does anyone have a test that is more definitively administered than perhaps what's available right now here in the US?
Yeah, so the technology that we actually use to produce to run this test is actually it's pretty basic technology that's been around for decades. And so every country more or less has some capacity to actually run a test like this. So if we look at South Korea, for example, they're actually running huge numbers of tests. So nearly overnight, they scaled their testing capacity up to the tens of thousands. And the United States still is in the hundreds. From what we hear, and there was just new news not just a few minutes ago, I haven't had a good chance to really digest what it said, is that there is going to be an expansion of who is allowed to run the tests. But this isn't, it's not a super sophisticated test that only a few labs could run. It's been more of a policy issue of which laboratories are allowed to run it, and it's been fairly restricted by the Centers for Disease Control.
Dr. Mina, can you just explain that really quickly? Because the declaration of a public health emergency, you're saying sort of ironically has made it more difficult to test. Why is that?
So the idea is a good one, and that's that at the beginning of an epidemic, we really want to be sure of the results. And so the CDC wanted to essentially take control and distribute testing kits to trusted laboratories, those of our state laboratories, as well as the laboratory at the CDC, to really be responsible for performing the tests. So the idea is very good, but at the same time, we want to. It ironically sort of also limited the amount of testing that could be performed within the country, and really prevents hundreds or thousands of different laboratories with capacity to actually be able to perform the test by really trying to have a little bit of maybe too much oversight over how the test is being performed. And in this case, I think it's a little bit of allowing the perfect to be the enemy of the good.
Are there patients that you think you and your colleagues there in Boston should be testing now? And could you be testing them now if you were allowed to? And then a third question, if you were allowed then to test them, do you think we would turn up more cases like we're seeing in California?
Yeah, so I think there are, essentially, if there's respiratory cases occurring in the United States at the moment, and they turn out to be flu negative, so they're negative for a lot of the regular respiratory viruses that we test for, we probably should be testing them at this point for this coronavirus. And that's because we don't know where the virus is circulating. And I think that the patient in California is a good example of how, unless we're testing and checking, we just don't know what's circulating in the community. And so there are patients throughout the whole country that probably should be being tested. And I actually think, to take that a step further, we should actually be extending testing, maybe not only to just patients coming in, but maybe even testing hospital staff and employees, and maybe going to, doing more of a surveillance effort to also be looking for this virus would be optimal from a public health and a clinical perspective.
Dr. Min, I wanted to ask you about a story that I saw this morning that I thought was particularly scary, that in Japan there was the first case of a woman getting reinfected with coronavirus. In other words, she had been discharged from the hospital and cleared, and now is back, and it had spread to her lungs, leading doctors, I guess, to worry about whether this could lay dormant and could make it very, very hard to tackle. Is that possible?
So I think that's really exposing just the huge number of unknowns that still remain for this virus. And these kinds of unknowns remain for any time a novel virus comes about. We have lots of questions about the basic biology as well as the public health implications. And this particular situation really raises the question of, if you get infected once, does the normal dogma that you develop immunity and can't be infected a second time still hold? And is it possible maybe that you actually maybe harbor the virus in you that in an undetectable way, and then it sort of emerges again? It's not usually a feature of coronaviruses, but this particular case suggests that maybe the immunity to the virus might not be sufficiently strong to prevent a second infection in some people. But it really, these are all very unknown questions. This individual might be an aberration. We just don't know yet.
Doctor.